Good morning, everyone. Welcome to the Hawaii Board of Veterinary Medicine. Before the meeting is called to order, we will play a short video to explain the procedures for this meeting and to explain how members of the public can participate and interact with the board members.
Welcome to the Professional and Vocational Licensing Virtual Board Meeting. When the meeting begins momentarily, the chair will take a roll call, explain any specific rules for this particular board, and then move to public comment. The name of the board member will appear on the bottom left-hand corner of your screen. For instance, this is board member Y, and this is board member E. Public testimony will be accepted at the beginning of the meeting and before each agenda item. You can indicate that you are ready to testify by clicking on the Raise Hand button being circled by the mouse on your screen now. At the appropriate time, the board will recognize you to speak and ask you to unmute your mic as shown here. Again, public testimony will be accepted at the beginning of the meeting and before each agenda item. Public attendees will not be able to unmute their microphone until recognized by the board. Public attendees who are recognized to testify will be asked to identify themselves by name and their affiliated organization if applicable. Please mute your microphone when you are finished speaking as a courtesy to others and members of the board. Public attendees will not be able to unmute themselves after the testimony is completed unless recognized again after raising their hand. At some point during the meeting, the board may choose to move into executive session. When the board moves into executive session, the board members' microphones and video feeds will be turned off, and a similar screen as you see now will be displayed. When the board returns from executive session, their microphones will be turned on as well as their video cameras. Welcome again to the Professional and Vocational Licensing Virtual Board Meeting. At this time, the chair will call the meeting to order and take a roll call, as well as explain any additional rules that may be specific to this board.
So I'm going to just go straight to the interview. Yeah. Okay. So to view the meeting and provide live oral testimony, please use the link at the top of the agenda. You'll be asked to enter your name. The board requests that you enter your full name, but you may also use a pseudonym or other identifier if you wish to remain anonymous. You will also be asked for an email address. So please fill in the field with any entry as email format, such as your name at email.com. Your microphone will be automatically muted. When the chairperson asks for public testimony, you may click the raise hand button found on your Zoom screen to indicate that you wish to testify about that agenda item. The chairperson will individually enable each testifier to unmute their microphone. When recognized by the chairperson, please unmute your microphone before speaking and mute your microphone after you're done speaking. For phone access, if you cannot get internet access, you may get audio-only access by calling the Zoom phone number listed at the top of the agenda. Upon dialing the number, you'll be prompted to enter the meeting ID, which is also listed at the top of the agenda. After entering the meeting ID, you'll be asked to either enter your panelist number or wait to be admitted into the meeting. You will not have a panelist number, so please wait until you are admitted into the meeting. When the chairperson asks for public testimony, you may indicate you want to testify by entering star and then the number 9 on your phone's keypad. After entering star and then 9, a voice prompt will let you know that the host of the meeting has been notified. When recognized by the chairperson, you may unmute yourself by pressing star and then 6 on your phone. A voice prompt will let you know that you are unmuted. Once you are finished speaking, please enter star and then 6 again to mute yourself. For both internet and phone access, when testifying, you'll be asked to identify yourself and the organization, if any, that you represent. Each testifier will be limited to 5 minutes of testimony per agenda item. If connection to the meeting is lost for more than 30 minutes, the meeting will be continued on a specified date and time. This information will be provided on the board's website. Okay, so we'll take roll call now. So members, when I call your name, please respond to with present or here. And if you are joining us remotely, if you could also state whether you are alone or if there's someone else with you. Dr. Craig Nishimoto, for licensed member.
Present, I'm alone.
Dr. Lisa Wood, licensed member.
Present and alone.
Dr. Gabrielle Assay, am I pronouncing?
AC.
AC.
Present and with the rest
Yeah,
of the
it's
room.
present. Yeah. Okay. And then, Dr. Kimberly Thompson Kerr, licensed member.
Present and alone.
Eileen Wada,
Present.
and myself, Dr. Tiffany Hummel.
Yes, she'll be joining us shortly.
Okay, so I will now call the meeting to order and the time is
Right, use the one on the screen up top.
10:17 a.m. So, may I have a motion to correct an aberrant event on the agenda? Just like, or 3AI
Yes.
should be Connor Weston Grimes to correct that on the agenda.
To correct what?
So she's asking for a motion to correct an inadvertent error on the agenda. Item number 3A1I should be Connor Weston Grimes, not Connor Weston. So we need to correct that on the agenda before we move forward.
May I have a second?
Second.
Thank you.
Any opposed? The motion carried forward, no opposition. So,
Dr. Ichizu and Dr. Iverson's 10:30 appointments are here.
that's not coming from.
Oh, that's the construction folks that are here.
Question, Chair, are we supposed to have approval of minutes or discussion of minutes?
Well, that's what we're moving on to now. We just
Yeah.
corrected the agenda. Now we can start on the agenda.
Yeah,
Okay.
sorry, we got some little distraction here.
There's construction noise in this room, so it might be a little delay for you.
Okay,
So agenda number 1A, right? Approval of the December 13th, 2024 open session meetings. Is there anyone who would like to provide testimony for this particular item on the agenda?
Thank you, Chair. This is Julie. We do not have anyone requesting to provide oral testimony.
Okay, thank you. Are there any corrections or amendments to the minutes? If none, could I get a motion to move? To accept the minutes?
Move to accept.
Thank you. May I have a second?
Second. Eileen Wada, second.
Any opposed? Okay, so motion carried forward. Okay, so moving to agenda item 2. Adjudicatory matters. Is there anyone who would like to provide testimony on this particular agenda item?
Thank you, Chair. We do not have anyone requesting to provide testimony.
So we're going to move into recess for the board to discuss the adjudicatory matters. Board members, you don't have to do anything. We have this fabulous new system and you just hang tight. There's going to be a little blank and then we're going to be in a private room, okay?
Okay,
All right, everyone, welcome. We're sorry for the technical difficulties. We're going to do a roll call and then we'll move forward with our agenda.
Okay, so members, when I call your name, please respond with present. And for those of you who are joining us remotely, please reply present, and if you're alone or if there's someone else with you. So Dr. Craig Nishimoto, licensed member.
Craig Nishimoto, present. I'm alone.
Dr. Lisa Wood, licensed.
Present and alone.
Dr. Gabrielle AC,
Present.
licensed member. Dr. Tiffany Hummel, licensed member. And then Dr. Kimberly Thompson Kerr, licensed member.
Present and alone.
Eileen Wada, public member, and myself, Marcella Chalk.
Thank you. At this time, we're going to pick up our agenda where we lost connection, which is agenda item 2, adjudicatory matters. Before we lost connection, we had already asked for public testimony and there was none. So at this time, the board is going to recess to consult with the board's attorneys on questions and issues pertaining to the board's powers, duties, privileges, immunities, and liabilities in accordance with Hawaii Revised Statutes 92.
She's not here.
Is that, no, that's, no, 92.5A4. Yeah, so, again, board members, hang tight, we're gonna put you into a private room for recess. Thank you.
Excuse me, Lisa. Dr. Wood, could you please
Yes.
join the other room?
Is this a theoretical question? Like they're just looking for what other medications exist?
Yeah, that's actually, did you get? I don't know.
Okay.
Oh, she printed all that off. Yeah. So that's all I got. So we just need to go through the questions.
Okay,
Yeah.
so, but that's a theoretical question. Like what else is there?
Yeah, well, so he may not know what all medications are, so.
Okay.
And then we're leaving, but they have 20 seconds.
Yeah, it takes a
Okay,
hot minute.
great.
Yeah.
She's okay.
Dr. Wood, can you turn on your camera and your microphone, please? Or at least your camera?
Good.
Yeah, okay. All right. That's your truck.
Okay, so we're back to open session. Applications. So agenda item number 3, applications. Is there anyone who would like to provide testimony on this particular agenda item?
Thank you, Chair. There is nobody, we do not have anyone requesting to provide public testimony.
Okay, thank you. Okay, so we have a motion to move into executive session in accordance to HRS section 92-5A1 and to consult with the board's attorney on any questions or issues pertaining to the board's powers, duties, privileges, immunities, and liabilities in accordance with, again, HRS section 92.5A4. Want the motion? To move into executive session?
Motion.
So we have a second?
Second.
Any opposed? No opposing, so motion carried, so we'll move into executive session. Thank you.
So it's just right around the corner. You go back out here. Where that was, it's under that, and there's 845.
I think the thing is that
No.
for us in pharmacy and stuff, the problem is that the people that come into Hawaii, they don't think that everybody is connected, all the states. So they actually do answer that question a lot, denying it. Then when we come back with all these
I should have
displays.
asked if anybody wanted a break before we came back in.
So it's unfortunate. What do you think? The place that a lot of people feel like they were gonna come and practice in Hawaii to get away from all the stuff they do on the mainland, because they don't think that we can find out.
Oh, that's interesting.
Yeah.
I mean.
Yeah.
Okay, looks like. Marcella, if you want to go ahead and get started, she's be ready.
Okay. Okay. So we're back, open session. So we're down to, agenda item 3.
3, yeah.
So may I have a motion in regards to the application for Dr. Connor Grimes?
Yes, this is Dr. Craig Nishimoto. I would like to move that we accept Dr. Grimes' application for testing pending receipt of further documentation.
Thank you. Do I have a second?
I'll second.
Thank you. Any opposed? No opposition, so motion move forward. And we have a motion in regard to the ratification list of the insured licensees, as well as courtesy relief permit and the restored license for Dr. Michael King.
I move that we accept ratification of issued licenses, as well as the relief permits and the restoration of Dr. King's license.
Thank you. May I have a second?
I didn't want a second.
Thank you. Any opposed? So no opposition, so motion move forward. Thank you. So moving to agenda item number 4, Executive Officer Report. Is there anyone who would like to provide testimony for that?
Thank you, Chair. We do not have anyone requesting to provide oral testimony.
Thank you. Go ahead, Harry, for your report.
Thank you. So we have, the first item are results of the exam for December, January, and February. December, we had 4 candidates, 2 passed and 2 failed. In January, we had 5 candidates that took the exam, 4 passed and 1 failed. And in February, we had 6 candidates, 6 passed and 0 failures, so it's looking pretty nice. Then the second one is in September 17th through 20th. The AAVSB will hold their annual meeting and conference in Cincinnati, Ohio. Registration is going to open in May. Because we are members of AAVSB, one of our benefits is to have one of our board members go, and the AAVSB covers the cost of the registration and airline flight. So we generally try to rotate this around for folks that haven't been before. Dr. Nishimoto has been, Ms. Wada has been, Marcella was last year, yeah. We were kind of hoping Dr. Wood would be available this year. Are you available this year? Your sound's off. Can you help Dr. Russell? Oh, there we go.
Yes,
Yes, so we're gonna put you down for attending this year?
yes.
When
Thank you.
registration opens, I will forward you the link, and they're very good about helping you walk through whatever questions you have, so.
Okay, thank you, Carrie.
All right, excellent. Now, anybody's welcome to attend. American Association of Veterinary State Boards.
Ah,
So anyone's welcome to attend. It's very informative. It's really good information, and they have CE. Is that correct, Dr. Nishimoto?
we do.
Yeah, and there's CE available if you want to get CE while you're
For
there.
veterinarians.
So we'll have Dr. Wood will go on our board membership. But if anybody else is interested, please let me know, and I'll send you the registration information when it comes out. That's September 17th through 20th. I just have to have 4 people here for a quorum, and then we'll be okay. I think that's all I have.
Okay, so moving to agenda number 5. Is there anyone who would like to provide testimony on agenda item 5?
Thank you, Chair. We do not have anyone requesting to provide oral testimony.
Okay, thank you. So we're looking at 5A. This is an email from Dr. Greg Morimoto from Vigo. And he has a list of questions in regards to, I guess, euphemism. I guess we all have a copy of that letter in 5A with his questions, 1 through 5. So do we have any discussions?
So there's a lot.
Carrie would like to start with anything.
There's a lot. So I guess the first question up in the body of his email is, do you know if a veterinary license is required to perform medicated and/or injectable euthanasia? And I believe the answer to that is found in 140.
The finalist here.
Sorry, in HRS 143, which says that animal control officers can also do euthanasia. Is that correct, Dr. Nishimoto? Am I understanding that?
Yeah. More for their term was like more disease than not so much the elective ones though. I was reading that.
Okay, so if it's 143.13, all dogs taken into custody of the animal control officer, which by reason of age, disease, or other causes are unfit for further use or are dangerous to keep impounded, may be forthwith humanely destroyed by the animal control officer. So 143 would only be for those items, not just because it was an excess dog. Is that correct?
It's kind of open-ended, Carrie, when it says which by reason of age, disease, or other causes.
Okay. Yeah, that is open-ended, yes.
My question is, where are the animal control officers getting the drugs from? Who's signing off on that?
That is a very good question.
Because ultimately, whoever is prescribing it would have to oversee the administration.
Yeah, they're taking responsibility for the drug, the
Right.
purchase and administration. We don't, I
And-
don't think our state determines if it has to be direct or indirect supervision on it though.
Well, that's a question, right? So the 143 provides that the animal control officer can humanely euthanize the animal. But then I guess we'd have to go back to Dr. Wood's question about who's in charge of the controlled substance, right? Who is the person prescribing that controlled substance? Because an animal control officer can't get an NED, right? They can't get an oral.
You can't get a DEA license unless you're a licensed physician, veterinarian. You have to have a medical degree or you have to have a research authorization to acquire Schedule II drugs. So that would be my first question is who's signing off on the drugs?
Okay. So in my response, I can definitely put that in there. I can say that 143.13 does allow animal control officers to euthanize animals. However, only a person, a veterinarian with a
DEA and an NED.
DEA and DEA, NED, NED can prescribe
Or even get order the
Access, yeah.
Yeah, you can't even have access to those medications unless you're DEA
purchase.
licensed.
That's okay.
Because that's the problem right now in Molokai, isn't it? There's no one to regularly there to provide access to those drugs. The performance of the euthanasia is not the issue so much, but access to the drugs to do so.
Okay. Okay.
Unless they're performing them with non-barbiturate substances.
Right. Yeah, which that's a whole other question.
Which
Whole other problem.
so I'm wondering.
So in the
Are there,
second question,
Yeah, go ahead.
in the second question, well, the first question on the list, other methods of euthanasia do include gunshot.
Mm-hmm.
You don't need a veterinary license for that. CO2, inhalation. There are other methods, but they're not recommended.
Okay. So the answer to that question is yes, there are other methods, and then I can list those three. And then I can say, but those are not recommended by, would that be the AVMA or?
AVMA, yeah, especially gunshot. I mean, that's kind of a last resort. You don't have any other way to restrain the animal. The animal's loose, the animal's dangerous. There's no way to approach him.
Okay, I guess they're recognized but not ideal. It was not recommended.
Correct.
Yeah.
I mean, if there's no other option.
Right.
Well, it also depends to some extent with like, not necessarily with small animals like dogs and cats, but with large animals with groundwater and contamination. Because I do livestock and I do non-barbiturate euthanasias because it means that they can dispose of the carcasses without risk of contamination of the environment. And I will heavily sedate animals so that the farmers can shoot them for safety, but the animals are, I mean, I'll knock them out. But the AVMA does have online a booklet of appropriate bullet size and techniques for species.
Well, I think for the purposes of this response, that's very good to know. The purpose for this response, they're working with animal control and they're using medicated euthanasia, but the employee is not a licensed veterinarian. So they don't know what type of medicated euthanasia is being used or if
Because
performing an injectable.
Because medicated euthanasia could be something like gabapentin and ACE for sedation, doesn't have to be controlled substances. And then it could be, you know, potassium. It could be, I mean, there's so many things that can be injectable euthanasia.
Okay.
You can even do like magnesium salts, like what you get drugs, and you mix it with water.
Oh, wow.
I would probably refer to that AVMA document
Mhm.
that lists the methods and I would not recommend most of those, like the
No.
potassium chloride, they want them to be sedated
Mhm.
Yeah,
prior to, and I don't think those are consistently good ways to administer euthanasia.
No,
I think they actually require or request a plane of anesthesia level. It's not just sedation, it's anesthesia level.
Yeah, I think you're right.
A cardiac effective,
Mhm.
such as magnesium or
And
potassium.
to the point of these questions, if the recommendation is that anesthesia level, is that something that a veterinarian is required?
It's gonna be a controlled substance, yeah.
Okay.
Not
Yeah.
necessarily. You can sedate and gas them, right? Mask them.
Yeah.
Yeah, okay,
Yeah,
okay.
but I don't know, I mean, they would have to be carrying around that type of.
So that goes to the question, would the other methods of animal euthanasia require the direct supervision of a licensed veterinarian?
Other methods are not required. I mean, if it's not involving a controlled substance, I don't think, again, that it's not ideal, but if you have an animal that's suffering, an animal control officer can shoot an animal. So just to answer his questions, what are the other methods of euthanasia not required? A veterinary license? I don't know if there's a larger scope of information that, I mean, so these are a lot of questions with a lot of intricacies in terms of how each is answered.
Mm-hmm.
So it's,
So with the best way for number 2 is that what other methods to answer that is that non-pharmacologic type of methods. If we could respond in that way to say the ones that are not involving any medications or any kind of pharmacological agents to answer that question, whether they would need direct supervision, assuming that all the others, would they need a direct supervision by a veterinarian?
What is it?
Direct, but at least indirect.
yeah.
Yeah, indirect. They need access, if they're gonna be using some type of pharmacological agents that are DEA controlled. Or even any type of prescription, they're gonna need
Mhm.
access to a veterinarian's license.
So do we define direct the same like I'm interpreting it from our statutes? Is that the
So direct
supervision needs to be there?
direct supervision is the veterinarian, the licensed veterinarian needs to be on site. So doesn't have to be in the same room, but has to be on site. Indirect means that the veterinarian is available by phone, video conference.
This individual, Greg, he brings up some really good questions. And I was unaware that the law was so ambiguous for euthanasia until he brought all these questions forward. So is this a case where they feel that an animal control officer is abusing his authority, or is it just a academic question to be sure we're not?
It appears to me, based on the email, that they've had some type of complaint. We are looking into a situation involving a government employee working for animal control protection. It has been alleged that the employee has been euthanizing animals using medicated euthanasia as part of their employment, but the employee is not a licensed veterinarian. Currently, we do not know what type of medicated euthanasia is being used or if the employee is performing injectable euthanasia. So that's what the questions are stemming from, that situation they're reviewing.
Okay, I think it's most important to identify the medications and who authorized them.
They can, if they have
Straight.
carcasses, you can do a toxicology screening
Oh, the like.
through labs. They're pricey. But you can run, they will run barbiturates and other substances.
That's good to know. I'll let them know if they follow up with that question. Probably they would have access to the records of what they used.
Well, if they don't, they might have access to the carcasses if they don't have access, like if they don't
Oh,
know
okay.
what that's using, because I've used it before to clients that I've been suspicious of stealing their pets' medications.
Okay. That's so sad, but I understand. Okay, so so we would need, we would say that
I guess my question too is that the government, the Animal Control and Protection Branch, is there a DVM working under that umbrella that is, I mean, I'm assuming not, because otherwise the question wouldn't have come up, but.
yeah, so I don't know the relationships of the various animal control agencies throughout the state, how closely they work with a licensed veterinarian in their area. So
Is
one
there-
would hope that, you know, they've got a veterinarian that's contracted with them that, you know, comes in and checks out the animals but
Is if they had somebody who's like prescribing the medications, assuming they're controlled substances, then as long as the person has been, again, is being supervised performing the euthanasia, it's more, I think, as we all, is access to the controlled substances, assuming they are controlled substances that are being used either pre being shot or if it's, you know, sedation and then barbiturate, you know, euthanasia. Yeah. I guess it would be interesting to know what the whole situation is.
so to respond to this email, tell me if I've got the bigger umbrella. Animal control officers are allowed by statute to humanely euthanize animals, 143.13. If it is a medically is induced, is that the right word? Medically induced euthanasia, the question.
Medically administered.
Medically administered euthanasia. The question is, what drugs are being used? And if they are a controlled substance, who authorized it? Is it,
Who has prescribed? Who is the prescriber?
who is the prescriber? Because, and then does that person, because animal control officers are allowed to perform euthanasia, that exempts them from having to have direct or indirect supervision from the veterinarian, so long as the veterinarian has prescribed those medications. Is that, am I reading that correctly, or would they still need indirect supervision of the veterinarian in order to provide that?
I think we should know what drug it is
Okay.
first.
Because if it's not it's not a controlled substance, then
If it's a controlled substance, they would still need to have indirect
they
supervision, you think? Because the prescriber is ultimately responsible for the drug.
Yeah, and when you purchase, you check off purchase or prescribe and administer.
administer. Mhm.
So the person signing off supposedly has to administer.
Yeah.
Okay,
And even the person holding, carrying the controlled substances
Right.
has to, I mean, you can't just, you can't say, here's your hydromorphone and go do it. You know, you've got to be there yeah, you're carrying it.
Okay, so, and based on the type of, based on, what happened? They're still there?
Yes.
They're
Yeah,
still
we
there,
can
we
hear
just
you.
don't see you, okay, okay, we just can't see you, our screen went black. So that response would be, based on the medication, a controlled substance would still require indirect supervision?
I would say access.
Or,
I think access is the.
yeah, so indirect would be access,
It would
yeah.
still require access to a veterinarian's, because we don't know what kind of supervision, direct or indirect, is going on. And there's also a lot of nefarious ways in which people can actually get these substances
Okay,
while working in or close contact.
And it says in his letter that he doesn't know, they don't know the type of medicated euthanasia.
Yeah.
right,
Um,
right.
So you could respond that, in order to answer that question, it would depend on what that medicated euthanasia, what is it that they're using?
What the medication is.
Yeah, and then that would help you answer that question number 2, whether,
Yeah.
indirect or direct.
Okay. Okay.
Would you guys agree? Because that would be a good place to start, and then that way you'll know where we could cite from where the statutes would be.
Mhm.
Because he just has her generically medicated, but we don't know
Right.
what exactly is the medication.
And it also says that he doesn't know if the employee is performing injectable euthanasia, so it may not be injectable euthanasia at all.
And that's why if they have the carcasses and they're fresh,
Oh, okay.
access to that, they can contact a lab about doing a toxicology and pathology scan. They're expensive, but it will get them an answer rather quickly. Narrow their fields
Okay.
rapidly.
Okay.
They're looking for.
So I think I have enough to respond. Basically, it's, based on the medication being used, would determine if the person needs, access to a veterinarian to use it. And, if it is indeed a controlled substance, there should be a veterinarian,
Associated
with the euthanasia, because a license is required to both purchase and dispense the medication.
Yeah, and then
Or access.
Dispense and administer.
Dispense and administer. Okay,
and
I
then
might-
refer them to the for alternative euthanasia techniques that AVMA lists.
okay. Okay. Is there someone who would like to volunteer to read over my response to make sure I don't put out incorrect information?
Sure, you can send it to me, Carrie.
Okay, all right. I think I know what, I feel confident that I have understood what you have told me, but, I also don't like to put stuff out and then find out I did not understand. Okay.
Yeah.
Okay, thank you so much for, walking me through all of that. I believe
I
I
have
understood what you told me. Yeah.
In reading what other states are doing, not that we need to do it, but at least discuss it in the future, where they have certification of animal euthanasia specialists.
Mhm.
Oh,
That's something we should explore. If it's too much regulation for our state, but the people should be trained properly if they're gonna be doing it.
I think there also needs to be ways of, that I agree that we can oversee or provide guidance when a licensed veterinarian is not available, or, a technician is not available, because there are definitely situations where there's animal suffering. We've had animals flown over to the Humane Society from Molokai, but there's been no one present to do that. So that would be it's definitely an issue I think we need to address.
okay.
Agree.
Maybe I reach out to some of those states and ask them what their program is and how they legislated that, and to maybe bring that information back to a later meeting for the board to discuss.
Right,
It's a
thank
big
you.
topic.
Can I make a suggestion? Is
Sure.
see if you can get a copy of that, the job description for this, officer. I mean, I would be curious to, you know, when they apply, right, for the job, what the job description says. Because,
Well, because question number 5, he asked if the employee of a government agency acting under their scope of their employment is allowed to euthanize animals without being under the direct. All of that, it's out of curiosity, it's just what is the, as far as what's the parameter for?
Yeah, what is the job
animal
description?
protection branch?
yeah,
So
so
what is
who's
their
giving
scope?
it the, this
Well, so
employee?
here's the, I'm happy to do that,
Yeah.
but I don't know what county this is. I don't know which animal control agency it is, so it'd be difficult for me to get the job description for that.
And then that's where I think for Dr. Morimoto, that's the
Yeah.
kind of clarifying questions
Yeah.
they need to provide for us to, in
Yeah.
order to provide the answers to his questions,
Yeah.
because there's so many.
Yeah.
Variables, yeah.
Yeah.
Mhm.
I'm just,
Job description, I got it.
yeah,
Okay.
but I think he's calling, this is for us, I think, right? Here in Hawaii.
Oh, yes.
Yeah.
So I'm curious to see what our Hawaii is. I don't care about the other people, yeah.
No, I'm saying that each county has their own animal control.
Are they each?
Oh, I mean like Maui,
I don't
Yeah.
know.
Island, they all have different
Yeah.
control?
Yes, it's not a state animal control agency. It's-
Ah,
Hawaii has animal control, Molokai, I'm assuming has animal control, Maui has animal control.
okay.
And Molokai is under Maui, just without a veterinary.
Yeah, generally, yeah, for most states. So, yeah, so that's what I'm saying, it could be. You may have to look at all 5 or
Mhm.
to see. Okay, I think I'm good with that. I've got a proof, I'm happy.
So moving to agenda number 5,
We'll see.
well, actually, it's
Oh, I missed 6. I went from 5 to 7. I'm sorry, everyone.
legislative matters.
Yeah.
Is there anyone who would like to provide testimony on agenda item number 6, legislative item?
Thank you, Chair. We do not have anyone requesting to provide oral testimony.
Okay, thank you. Right, you're gonna go over.
Oh, yeah. So
All of
lots
these.
of fun. So I want to thank your legislative liaisons, Dr. Nishimoto and Dr. Wood, who helped me out because things came up fast and furious, and so they were able to help me walk through some things. Item A is SB 493. We're now on Senate Draft 1. It's titled Relating to Veterinarians. We oppose this, not that we oppose the idea, but we oppose us being in charge of it. We are in support of the intent of the bill, but oppose
Yes.
the legwork of the bill. So this is very similar to a bill that was filed in 2024, which the board also opposed. It proposes to create a scholarship and loan repayment plan, which the board would have full responsibility for, including creating requirements for both the scholarship and the loan repayment, awarding the scholarships, and the full administration of both the scholarship and the loan repayment. That's the part we don't like. The board previously determined that it does not have the expertise necessary for these duties, and that historically boards do not do this type of work. The bill has crossed over from the Senate to the House and has been referred to the Ways and Means Committee. That's the last I've heard. They've changed the effective date to July 1, 2050. So I suspect next year there'll be another version come before us, but that's where we're at on this one. The second bill is SB 874. Oh, I'm sorry, there's new board members. Anybody have any comment?
That sounds lovely.
Yeah, you guys don't want to do a loan repayment, okay, all right. SB 874, relating to veterinary medicine. This is one that we were just tracking because it doesn't require anything of this board, but it would require veterinarians to provide a written prescription upon request of a client for any animal patient. It would allow pharmacies licensed in the state to dispense those medications prescribed by veterinarians. And it would authorize the Hawaii Board of Veterinary Medicine to establish penalties, which may include fines or suspensions. It died in committee, so we don't have to move forward with that one.
Really?
Yeah. Maybe we weren't tracking that. Maybe we were going. Anyway, I put tracked, but it died, so that's. C, HB 364 House Draft 1 relating to animal control. We provided comment on this bill. It would, it started off a little bit different than the current version. It started off that it would require cats under the age of 3 months to be surgically sterilized. The new draft says it would require female cats over the age of 3 months and male cats over the age of 5 months to be surgically sterilized with certain exceptions. It authorized county animal controls authorities to enforce a permit program for breeders, and it established it as spay and neuter fund. It was reviewed, went through a couple of different committees. It was deferred by the Committee on Judiciary and Hawaiian Affairs with an effective date of July 1, 2000. The breeders had some issues, and so the legislation deferred it so that there could be more discussion. What we commented on was the age of the cats being, we felt that in the first iteration of this bill that it was just too young for these cats. We'd cause problems later on. So we talked to them about upping the age of the cats for when they should be neutered, and they were amenable to that, but it's been deferred now for other reasons. The next bill is HB 547, Draft 1. We are tracking this. It's relating to spay and neutering. It's to create revenues and reduce the cat population effective July 1, 3000. It has a companion bill, SB 1023, which we'll talk about later. Those two bills are still alive. They're crossing back and forth between the two houses at this time. Number E, SB 394, relating to spay and neutering of animals. We were going to track that, but it died in committee. F, SB 566, relating to the spay and neutering of animals. We were also going to track that one, and it has died in committee. And the last one is G, SB 1023, which we discussed with HB 547. It is still effective, still moving forward. It's crossed over, and effective date 7/1/2000. We've been following getting the funding for spay neutering for since I joined the board, and I suspect we'll keep doing it till it's actually done. So we'll just keep tracking and see what happens. And that's all I have for our bills. I won't bring back any of the ones that died next time. We'll just talk about the ones that are still alive.
I'm kind of curious. At one time, years and years and years ago, the city basically used to offer a discounted price. So you go to any of the satellite, and then you pay, like, I think this is a long time ago. I think it was either $75 and a $125. For a female was $125, and it was $75 for a male. And then you go, you pay the money, and you get a certificate. And then you go to the whole list of veterinarians that would spay and neuter. I haven't heard of anything since 15, 20 years ago. So
Yeah, unfortunately, I don't know if that's still in effect.
yeah, but that kind of helped with the because I've been hearing that now the cost is in the thousands.
Yeah,
I mean, how
it's
can
right
people
around the
afford it?
pandemic.
Yeah.
I think it was, I remember because we participated. It was sponsored by the Humane Society.
Yeah,
Like
well,
they had some kind of grant or whatever, but
yeah,
then
yeah.
when they run out, they don't have anything to offer.
Yeah, I mean, but that would be not the wild cats, which we have a lot, but just even for just individual owners,
Is that the neuter now or is that different?
just a comment.
Yeah,
Uh,
there's lots of different programs that folks are trying to help folks manage the cost of spay and neuter.
Okay. Okay, so, if there's no other agenda item.
So our next meeting will be June 4, here in this room, or via Zoom.
If there's no any further business, then the meeting is adjourned at 11, is that 59?
It is 15.
Well, if I don't see you, Dr. Craig, I mean,
Well,
enjoy your trip to Thailand.
Hopefully
It's
I'll remote.
absolute- And well,